Hello class, this is my presentation on sexual disorders and with paraphilic disorders. And right off the bat, I would just like to read from the DSM-5, just kind of a definition of sexual dysfunctions. Sexual dysfunctions are a heterogeneous group of disorders that are typically characterized by clinically significant disturbances in a person's ability to sexually or to experience pleasure. An individual may have several sexual dysfunctions at the same time. In such cases, all the dysfunctions should be diagnosed. So we can see with sexual dysfunctions, there are 4 different types of sexual dysfunctions: desire disorders, arousal disorders, orgasm disorders, and pain disorders, all associated with sexual dysfunction. Now, how sexual dysfunction disorders differ from paraphilic disorders, I think it's important for me to read the definition of paraphilic disorders. Paraphilic disorders are known that because of their noxiousness or potential harm to others are classed as a criminal offenses. The 8 listed disorders do not exhaust the list of possible paraphilic disorders. Many dozens of distinct paraphilias have been identified and named, and almost any of them could be, by virtue, its negative consequences for the individual. I think it's important. There are 8 different types of paraphilic disorders: voyeuristic, fetishistic, exhibitionistic, frauduristic, pedophilic, transvestic, sexual sadism, and sexual masochism. Paraphilia in and of itself is just kind of the idea of a fantasy or something that promotes that arousal. It can be invasive to someone else, non-consenting, versus a sexual dysfunction, which is just more of a physiological dysfunction because of a psychological issue. And it is usually the key difference between sexual dysfunctions and paraphilic disorders is that of consent. Paraphilic disorders a lot of times are non-consenting, whereas sexual dysfunctions, really, consent isn't a problem because they are more of a physiological problem and just a dysfunction within a failure of sexual organs, whereas paraphilic disorders are more invasive to another person. In this section, we're going to be talking about oppositional defiance disorder, conduct disorder, intermittent explosion disorder, and disruptive mood dysregulation disorder. Now, all of these disorders are similar because they all cause a disruption to the people around them. Oppositional defiant disorder is characterized by a pattern of angry, irritable mood, argumentative, defiant behavior. Conduct disorder is more severe and actually more rare than ODD. It actually involves a pattern of behavior that violates the rights of others and such. Common behaviors associated with conduct disorder include aggression, theft, vandalism, deceitfulness, and violation of rules. Another criteria is forced sexual action on someone. Intermittent explosive disorder, just characterized by recurrent outbursts of aggressive behavior that are disproportionate to the situation. There are significant similarities and differences in these disorders, primarily just because of age of onset. They differ in the nature of their behaviors, their underlying mechanisms, ODD and CD primarily involve behavioral problems, while IED, intermittent explosive disorder, is characterized by impulsive and aggressive outbursts. The kind of outlier is DMDD, disruptive mood dysregulation disorder, and it's kind of the outlier because it actually is a mood disorder, and so you would treat it a little different than you would the other three. With the three here, ODD, CD, and IED, would be more cognitive behavior therapy treatment. DMDD would be use pharmacological treatment, actually trying to boost the serotonin in someone's brain, converse rather than cognitive behavior therapy. So watching the videos about addiction and substance use disorder, I know, and we can say that it is important to know the difference between specific substance abuse specifiers, because that makes a difference on how we treat those different disorders. It's going to be different with an opioid use disorder, but differing from a stimulant or alcohol use disorder. So just understanding these differences between specific substance abuse disorders, because it significantly impacts the assessment and the treatment and the overall treatment plan that we're going to put in place for that patient. All of the information that I've gathered is from the DSM-5. Thank you.